In today's Health Watch, we're talking about cardiovascular disease. It is the leading cause of death in this country. Did you know that? Nearly 120 million adults in the U.S. live with the disease. That's nearly half of adults, and it is expected to get worse. A recent American Heart Association report projects heart disease and stroke will affect more than 60% of Americans by 2050. That's a lot. We are joined by CBS News medical contributor Dr. Celine Gounder. She's editor-at-large for public health at KFF Health News. I'm so glad you're here. I mean, heart disease is one thing I always worry about. Both my parents died of heart disease. I've outlived both of them. As I sit here today, I've outlived both my parents, and it's something I think about constantly. I've got high blood pressure, high cholesterol. They say it's all part of your DNA. And even on medication, the numbers are still going up. Why is that? Even when you're doing the right things.
This is a very concerning trend that by 2050, it's estimated that 6 in 10 adults will be living or dying from cardiovascular disease. And so why is that? This is really a factor of we tend to emphasize, prioritize sick care in this country, not preventive care. If you look at how we spend relative to other high-income countries, we spend far more and get far worse health outcomes. And we're not prioritizing primary care, public health, which are the things that would prevent cardiovascular disease. And so why is that? Well, we don't have enough primary care providers. And some of this is driven by how we compensate different kinds of doctors. So specialists are paid about 40% more than primary care providers. Of course, if you're in school trying to decide what am I going to go into, you know, that is going to influence your decision making. And then on the public health side, of the $4.5 trillion we spend on health in this country, only 4% of that is for public health.
That's amazing. I mean, you make such a good point. We call it health care, but really it's sick care.
Right.
And it's not even care.
It's not even care. It's not even care. Could weight loss drugs like Wegovy help turn around these numbers?
So that's an interesting question. For people who can afford them, access them, and tolerate the side effects, they have been very useful. But not everybody can, and these drugs remain in relatively short supply, and they're quite expensive. Over the weekend, I was at the annual meeting of the National Academy of Medicine, and there was a session all about GLP-1 drugs with the top researchers in this space. And there was a lot of enthusiasm, but also a lot of skepticism and caution, and really the acknowledgement that we are not going to be able to treat ourselves with these drugs out of the obesity epidemic.
So what health factors are there that will drive up this increase in cardiovascular disease?
Yeah, so we've made progress on a couple. So smoking and high cholesterol, we have made progress on. Smoking was really the result of public health educational campaigns, taxes, regulations on how they're sold. So we've made progress there. But the things that we are seeing go up are obesity, diabetes, and high blood pressure, and that is being driven by high calorie, high salt, high fat, high sugar foods that are ultra processed.
So it's good to be preventative.
All the good stuff.
All right, Dr. Gounder, thank you.